As a person with an anxiety disorder, I can tell you that one thing that we hate to hear is it's all in your head. But through extensive research, I have discovered they were right. It is all in your head. This is the chemistry behind anxiety disorders. What is an anxiety disorder? Anxiety disorders are defined as a group of mental disorders characterized by feelings of extreme anxiety and fear. Now, we've all experienced anxiety and fear at different times in our lives. It's normal to feel anxious right before a big test or performance, or to worry when facing a big decision, to be afraid when home alone after watching a horror movie. But what constitutes an anxiety disorder is when that worry, that fear, those anxious thoughts interfere with one's ability to function in daily life and activities. When the anxiety gets in the way of one's ability to live, laugh, and love. Anxiety disorders can be classified into 4 specific types: panic disorder, social anxiety disorder, specific phobias, and generalized anxiety disorder. A panic disorder is a condition in which an affected individual has feelings of terror that strike suddenly and repeatedly with little to no warning. Social anxiety disorder involves overwhelming worry and self-consciousness about everyday social situations. Specific phobias are fears of a specific object or situation. Generalized anxiety disorder, or GAD, is characterized by persistent and excessive worry about a number of different things. Individuals with GAD find it difficult to control their worry. They may worry more than what seems warranted about actual events, or may expect the worst when there is no apparent reason for concern. From personal experience, I can tell you, anxiety disorders are not fun. I have generalized anxiety disorder, so I'm basically stressed all the time. Things that would seem easy or doable to most people, like asking a teacher a question or sending a text message, are 10 times harder for me. Most of the time I start out feeling fine about things, but then I start to think about everything that could go wrong and begin to panic, becoming immobilized by my worries and fears. I, like many others, tend to internalize my anxiety, so many people do not notice, but trust me, it's there. I personally do not take any medication for my anxiety condition, but there are many medication options available, such as Prozac, Zoloft, Effexor, Valium, and Xanax. Many of these medications are technically antidepressants that can also be used to treat anxiety. Psychotherapy is another method of treatment in which patients work with a counselor to come to terms with their anxiety and to develop coping mechanisms to better manage it. Now that you know what an anxiety disorder is, let's go over what makes it happen. Research is ongoing to determine exactly what causes anxiety disorders, but one thing that has been determined is that it is partly caused by an imbalance of chemicals in the brain called neurotransmitters. Neurotransmitters are special messengers that are responsible for heightening or suppressing the brain's stress response. The 2 primary neurotransmitters responsible for anxiety disorders are serotonin and gamma-aminobutyric acid, or GABA. Serotonin is a chemical messenger that is believed to be responsible for maintaining mood balance, leading to well-being and happiness. GABA is a chemical messenger that plays a role in the body's response to stress and is said to help control fear and anxiety. GABA is the brain's tranquilizing neurotransmitter, and billions of brain cells respond to its signals. When a person's serotonin and GABA levels are off, they are more likely to experience an anxiety disorder. Because imbalances in different neurotransmitters is part of the anxiety disorders, what medications do is alter the levels of those neurotransmitters. For example, some prescription medications such as Xanax and Valium fall under the category of benzodiazepines. Benzodiazepines work by enhancing the effect of the neurotransmitter GABA. The drugs contain chemicals which add to the calming effect already produced by the human body and essentially keep the brain in a more tranquilized state. Another category of medication that can be used to treat anxiety are selective serotonin reuptake inhibitors, or SSRIs. SSRIs block the reabsorption, or reuptake, of the serotonin in the brain, making the serotonin more available. This increase in serotonin means an increase in mood and a decrease in stress. As with all medications, anxiety medications come with many side effects, including dizziness, insomnia, etc. A notable side effect of benzodiazepines is that sometimes one can develop a lack of emotion or depression due to the tranquilizing effect of the increased GABA. This is why benzodiazepines are not recommended for long-term treatment. Another form of treatment is psychotherapy. In therapy sessions, patients talk through their feelings of stress and anxiety and are taught coping mechanisms to better deal with it. One very important part of this therapy is retraining your brain's chemical responses to triggers. By training your brain to react positively to events or situations that would often trigger anxiety or stress, you train your brain to release positive, calming chemicals rather than those that heighten feelings of stress. There is a large debate in the world of mental illness as to whether or not people should use medications to treat anxiety. There are good points on both sides. The downsides to medications are the numerous side effects and the fact that sometimes people's personalities can seem different when they are taking these medications. The plus side is obviously that it helps people to feel less anxious all the time and to be able to better enjoy life. Many people believe that the most effective treatment should include both medication and therapy. I talked with Barb Anderson, a former therapist and a current employee at the Iowa Department of Education, about her professional opinion regarding the best methods for treating anxiety. It is her belief that medication is not always required and that many individuals can learn ways to manage their anxiety through counseling and various self-help strategies such as meditation, yoga, or art. However, for some, medication can be very beneficial, especially if coupled with therapy. One of the biggest obstacles individuals with anxiety face is stigma, which can lead to discrimination and social isolation. Individuals with any number of mental health challenges are often afraid to talk about their feelings or their struggles because they are afraid of how others will respond. As a society, we have historically had negative attitudes about mental health and mental illness, but as we have seen today, mental illnesses such as anxiety are real illnesses caused by real chemicals in our brains. We do not hesitate to talk about our physical health, so why is it so hard to talk about mental health? It is just as real. We need to be able to talk openly about our mental health symptoms if we want individuals to experience true and total wellness, because total wellness includes both physical and mental well-being. Let's break the silence and get the nation talking. Help spread the message that these disorders are real health issues that need to be discussed, so that those suffering in silence know that they can get better. They can achieve wellness.